I am Holger. We're going to talk about the Epi Pen for just a moment. As you may have read in your book, EpiPens are used when somebody has a very severe allergic reaction. Now we want to make sure that the person who has the reaction really is having a difficulty breathing, or you are seeing rashes or swelling, as allergic reactions can come from so many different sources, from foods as well as stings and bites and so forth. The EpiPens will come in very handy for those who really need them. Now most people who carry EpiPens are pretty much aware of what their dangers are, and they will let you know where their pens are. EpiPens still look like this for the most part. There are new ones on the market, and some of the generic ones look a bit different. But other medications are now being packaged in very similar pieces of apparatus. So make sure that what they hand you is actually an EpiPen and not insulin or something else. Secondly, the person's name should be on the EpiPen that you're about to give them. There are two different kinds of EpiPens, those for adults and those for children. They're called regular EpiPen or EpiPen Junior. They need to be marked. And the very important thing to remember is to never, never, ever give an adult pen to a child being anybody under about 80 pounds, because the doses are rather different. Now all EpiPens have two ends, the safety end, which always has a cap of some sort that should be in place when it's being carried and when it first comes out of the package. That makes it very safe. Nothing can happen to that EpiPen while that safety is in there. The action end is usually orange or brightly marked, and this is where the needle will come out, and that's how EpiPens work. They automatically push a needle out, which then injects the epinephrine or the adrenaline, which is in there, into the person. So in order to use the EpiPen, you need to pull the end off, take a firm grasp of the EpiPen, and then part two starts. Where do we put this? Generally speaking, we want to inject the patient in the side of the thigh, about the middle. What we're looking for is a lot of good muscle tissue. Very, very thin people and very small kids might sometimes need to use the inside of their thigh. It's somewhat of a diagonal, so because there's just not enough muscle tissue here. Never ever let anybody stick their EpiPen into the top of the thigh, because the needle is long enough to simply stick in the bone, and then the EpiPen will not be able to discharge. So we want to use soft flesh on the side. Now the needle is very strong. It will go through your jeans, it'll go through Carhartts, it'll go through lederhosen, but it will not go through, iPhones, iPads, MP3 players, or wallets. So make sure that that side of the person has an empty pocket and nothing in the way, pens and so forth. Now I prefer teaching the thwack method. Isn't that fun? There's a certain amount of force required to release the pen, as you may have noticed. Nothing has happened yet. So you want to practice with the pen that you're given, just how hard you've got to hit somebody or yourself in order to inject that. So you want to get ready. I personally like to hold onto the patient's knee so that they don't move out of the way. Take a little bit of a swing and then thwack, and hold it there for 5 seconds. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. Then pull the pen straight out, and as you notice, the end got much longer. It's now protecting you from the needle. At the same time, rub the area for about another 10 seconds to help the medication disperse. Now, is this going to solve the patient's problems? It may make it better, it may not. In that case, you may need to give them a second pen, a second injection, not with the same pen, but with another pen. With children or anybody under 80 pounds or so, anybody using a junior, should make sure that there's always at least 20 minutes between the application of pens. With adults, you can stagger it probably a little bit faster. There are newer EpiPens on the market, so make sure, again, that whatever they hand you is an EpiPen. What do you do with the used one? Don't just throw it away. keep it, and then hand it to the next step that you absolutely should always do, and that is call 911 and make sure that person gets proper medical attention. And that's the Epi Pen. Thanks.